Welcome. This program is one in a series of 8 webinars that have been captured to help brain injury survivors, caregivers, educators, healthcare professionals, and other community stakeholders better understand brain injury and provide support to those who are living with the aftermath of brain trauma. This series of presentations was originally designed to help parents and educators assist children and youth with brain injury successfully transition into their school environments. While many of the examples and references made throughout the presentation are school-centric, the overall content has proven very helpful and relevant to most families coping with brain injury. The content of this webinar presentation specifically focuses on family issues after brain injury. I am Fran Moon, pediatric neuropsychology consultant and school psychologist, and I am delighted to present this program to you today. This webinar series has been created thanks to the professional expertise and volunteer efforts of members of Georgia's Brain Injury and Spinal Injury Trust Fund Commission's Child and Youth Committee. The Brain Injury Association has been a collaborative partner in this effort. The production of this program was funded thanks to the Avenues of Service grant from the Rotary Club of Gwinnett County. We are grateful to everyone that has played a part in making this programming possible. We've got lots of valuable information to share with you, so let's get started. We have set the following goals for this presentation. Increase awareness of the physical, emotional, social, and financial factors impacting the family after a brain injury. Understand the changing dynamics for families across the brain injury recovery period. Learn to recognize potential factors leading to family-school tensions to achieve family trust. Brain injury is one of the most difficult situations to which a family must adjust. Chris's parents, Mr. and Mrs. Jones, were sound asleep in their home in North Carolina when there was a knock at the door. Mr. Jones got to the door first, followed by Mrs. Jones. There was an officer at the door who told them that there had been a wreck and their son was in the hospital. Mrs. Jones let out a heart-wrenching scream. Just 3 days ago, they had dropped their son off at the airport to fly to Arizona to spend 2 weeks with his aunt, uncle, and 2 cousins. Chris had been looking forward to this for months, going fishing, boating, and sightseeing. Chris, a 14-year-old male, was riding with his relatives to the lake when there had been a single-car motor vehicle accident. His uncle had been killed in the accident, and Chris was unresponsive at the site. He was rushed to the hospital. In shock, Mr. and Mrs. Jones threw some clothes into a suitcase, woke up their other 2 children, dropped them off with friends, and flew to Arizona. Nothing in their past had prepared them for traumatic brain injury, the coma, the recovery, and how it changed every aspect of what they had known before. Why should we be concerned about family well-being? To ensure the best treatment for brain-injured child, the well-being of the family must be kept in mind. Studies had demonstrated that better emotional functioning in caregivers was a predictor of stronger academic and better behavioral functioning of a child 1 year post-injury. It has been suggested one of the best interventions for children with traumatic brain injury is to ensure the child has parents who can be effective, committed advocates for their child. The following statement was made by a parent. I felt the pain of nearly losing my 10-year-old son. He survived but suffered a traumatic brain injury. We were just a week shy of the 1-year anniversary. He's doing really well considering where we started. But often I wonder if there will ever be a time I won't grieve for the child that I lost that day. It is so strange to grieve for someone sitting next to you. In one study looking at parents' perspectives of how professionals interacted with their child and with them, the examiners interviewed parents at 4 months and 36 months post-injury. The following information was reported. Despite awareness of the seriousness of their child's situation, parents focused on any positive aspects of their child's health condition initially and over time. Parents expressed sorrow over the fact they may need to amend the expectations that they had for their child's recovery. Parents felt the only conversations they had with professionals focused on the parent understanding what their child cannot do. And we need to keep that in mind when we're interacting with families. Parents felt that while remaining available to meet the physical and psychological needs of their child, they often neglected caring for their own needs. Parents felt that professionals in whom they had trusted their child's care and education were willing to give up too quickly or were too narrowly focused. Above are mentioned some common family stressors. The implications of traumatic brain injury on childhood can be devastating, often resulting in long-term or even lifelong disability for the child. The impact of any illness or injury in a child will affect each member of the child's family in some manner. Understanding this impact is important because awareness of family members' burdens and needs over time enables educators to better support families and address their needs. Further, because family functioning has been linked to recovery of functioning in the child with a traumatic brain injury, facilitating family adjustment has an important potential to improve child outcomes. The impact of TBI on the family. Parents of severe brain-injured children report more stress involving spouses and siblings and parent depression. Many families of brain injury survivors ignore their own personal health, social, and emotional needs in order to treat the needs of the brain-injured family member. When looking at day-to-day activities, there are changes in family leisure time, relationships with others, and daily routines. The more severe the injury, the greater the amount of stress is placed on the family. For example, traumatic brain injury usually involves enormous hospital and rehabilitation costs. Often insurance coverage is inadequate or non-existent, leaving the families with huge debt. Neurobehavioral disturbance of the person with the injury is the strongest predictor of caregiver distress. A significant portion of caregivers of individuals with brain injury experience psychological stress and family disruption. When families bring home their brain-injured family member, they are often unprepared for the demanding medical needs and financial burden. Many struggle with their child's challenging behaviors as well as monitoring medication and overall health. They become the nurse, the speech-language pathologist, and everyone else. In many instances, caring for their brain-injured child changes the dynamics within the family. Some family members struggle with adapting to the child's new identity, while others demonstrate anger and frustration at the child's impaired abilities. Parents and siblings often sacrifice social interactions and recreational activities in order to care for their family member. So mom, who used to play tennis 3 times a week, may not be able to access those activities. Studies have demonstrated that having a sibling with a traumatic brain injury can have profound and enduring negative and positive life changes for non-injured siblings. Children often feel lost and abandoned when family members spend long hours and nights at the hospital. Needs of the brain-injured child at the time of injury, during rehabilitation, and after returning home can disrupt the typical routines that compose the siblings' days. The siblings might have to move in with relatives, and siblings may resent the loss of attention from parents or feel guilty about the injury. Siblings may hold on to fantasies that once the sibling returns home, that everything's going to go back to normal. However, they find out that that may not be the case. When their injured sibling returns home, they may realize changed personality and caregiving needs difficult to understand. Families often feel socially isolated. They become so consumed with caring for their injured child, they no longer have time for interactions with peers or participation in activities that they found rewarding in the past. One father described his life as this after his son's injury. After 5+ years, friends and family do not ask how Tommy's doing anymore. They don't visit him. I feel like I'm stranded. It is hard to make the tough decisions that need to be made, and the decisions are always up to me. My and Tommy's life has changed forever. Effective family functioning. Pre-injury family functioning predicts post-injury family coping skills. When addressing pre-injury family functioning, the emotional climate in the home, flexibility of the family to respond to stressors, communication skills within the family, and group problem-solving skills were identified. Most families have had no experience with traumatic brain injury or mechanisms of the brain prior to having a family member with a brain injury. So obtaining knowledge regarding traumatic brain injury provides family members with a framework in which to understand what is happening with their family member. Avoiding social isolation is important for effective family functioning. Accessing community resources provides a support system to assist families avoid becoming isolated. Informal networks include relatives, friends, coworkers, and social networks that are useful. Accessing formal helping networks is imperative. Formal helping networks include rehabilitation programs, medical care providers, and special education services. Recovery parents' perspective. There was a knock on the door and the officer said that my son had been in an accident and was in the hospital. Phase 1 is the time of injury. Families deal with the immediacy of the injury. Yesterday, they had a healthy third grade student, and today they have a child that's in the hospital. Decisions have to be made with very little knowledge about traumatic brain injury. Parents begin to realize that they don't have a lot of control over things. Some challenges during this period include understanding the medical information that's being given to them, forming trusting relationships, and starting to learn to take control in healthy ways. Emotional responses associated with the time of injury include shock, loss of control, grief, hope that something will happen to restore things back to the way they were, anxiety, anger, confusion, exhaustion, relief, and potential acute traumatic stress response. My son Greg suffered from a traumatic brain injury on May 4th, 2017, and is still in a coma. I believe he's responding to me, but doctors don't believe me. I'm in the hospital almost 24/7, and every doctor says something different. I am so confused about the outcome and what to be expected. Phase 2 is the coma phase. And what is happening during that phase is lack of knowing what's going to happen with their child. Doctors saying they just don't know yet. During this period of intensive care, some parents first begin to experience social isolation, which later becomes a major concern. Challenges during this time include understanding the changes and what they mean, shaping expectations, and managing all of the other family and life responsibilities. Emotional responses associated with the rehabilitation stage include depression, ambiguous loss, which is the part of grieving the child that you had and learning to know the child that you have now. And anxiety, grief, and what they refer to as reality slams, which has to do with finding out so many things have been changed all of a sudden. Phase 3 is the intensive rehabilitation phase. Parents report the rehabilitation phase is all-absorbing. Typical family routines and schedules, as well as social interactions, are disrupted as the parents either spend a lot of time at the hospital or devote a significant amount of time for the child's rehabilitation at home. For many, these efforts are exhausting and isolating. I didn't lose my daughter, but I did. She is someone different, someone I love equally, but someone angrier, more cynical, less sharp, less fun-loving, less smiley, and more cruel. I miss her, and I miss who I was. Phase 4 is reintegration into the home and community. Some consequences of the brain injury do not become apparent until the child returns to the original home and school setting. Challenges during this time, the family is faced with the challenge of understanding the fluid, indeterminate effects of traumatic brain injury, updating family roles, working with independence versus dependence, community integration, and preventing exhaustion, burnout, and fatigue. Emotional responses at this phase: insecurity without staff availability, fear about having to do everything themselves, depression, which is easily overlooked in caregivers because they don't look like a typical depressed person who's in bed all day with the covers over their head. They look more like the Energizer Bunny. Exhaustion and isolation. So we see that each stage of recovery, stressors on the family constantly change. Once they get adjusted to one situation, they're thrown into a new situation. For many families, changes in personality and behavior pose the greatest challenge. Although the effects of a traumatic brain injury vary tremendously, they typically involve some social, behavioral, and emotional effects. The ways in which psychosocial problems develop vary with the child's age of injury. Among younger children, problems may not emerge for several years. For adolescents who sustain a traumatic brain injury, the psychosocial difficulties are often more debilitating than the actual effects of the injury. The ability of the family and child to realize and deal with the reality is critical. In addition, there is evidence that the expression of behavioral effects is age-related, with younger children displaying overactive, difficulties with attention and aggression, and older children displaying more difficulty with impulse control and difficulties with self-monitoring. Further, difficulties in self-control, compliance, motivation, mood, or self-esteem may need to be addressed in all children of all ages. The impact of a traumatic brain injury may result in greater dependency on others due to physical limitations or impaired judgment. Failure of a child to recognize deficits imposed limitations may cause the child to view parents as unreasonably restrictive, thereby bringing about serious family conflicts. Initially, after the injury, friends usually show up and visit. However, as time goes on, friends stop calling and coming by. Also, the child's difficulty maintaining friendships adds to the demands of the caregiver experiences by the family. As former friends fade away, family members increasingly try to fill the gaps. These family members may become the only source of social support or may take the responsibility of orchestrating the child's social life. This may make the family member not available for previously enjoyed social interactions with others. It is important to understand all of the stressors that families have. A list of them is provided for you here. Parents' involvement is critical to achieving family trust. We need their input when a child is returning to school after a traumatic brain injury. Parents have the most knowledge about their child and are deeply invested in their daughter's or son's well-being. Respecting the parents' knowledge is important to helping the family understand that their input is valued. Parents can also serve as the go-between with the hospital and the school to make sure all of the necessary information is available. Taking the time to listen to the parents and including them in decision-making can serve to establish a positive relationship between the school and the parent and establish trust. Educators and family members need to understand the severity of the injury. Rehabilitation specialists can evaluate the student's current strengths and abilities and recommend possible supports both in and out of the classroom. This can be used to help the teacher understand the needs of the student. Few special or general educators receive pre-service training specific to the frequency of traumatic brain injury or its effects on students' education performance and behavior. Some teachers may initially be enthusiastic about trying new approaches to meet the needs of the student with a traumatic brain injury, but quickly become discouraged by the pattern of responding. For example, the student understands a concept one day, but not the next. Disagreements between school personnel and family of a student with a traumatic brain injury can quickly become extremely emotionally charged, making resolution difficult. Many such disagreements can be traced back to different, sometimes polarized views parents and teachers hold of the student and of each other. To avoid these tensions, it is helpful to keep the communication avenues open between home and school. For some children with a traumatic brain injury, their perception is that everything's going to be great once I get back to school. Everything will go back to the way it was before the injury. For these students, their lack of awareness may serve as a hindrance upon return. For other students, their level of anxiety about their return can be overwhelming. To help students with the mystery of returning to school, scheduling school visits with a small number of friends may assist with relieving anxiety. Because the classroom is a community, including the classmates in the preparation for the return of the injured child promotes support. As with any plans made associated with the student with a traumatic brain injury, the parents should be included in the planning. Making sure that the fellow students and the family are included in the process will facilitate a positive transition. And we have provided at the end of this presentation several slides with resources that you may find helpful. This is one of a series of 8 webinars We invite you to access additional webinars in this series. Webinars and other great resources can be found at these sites. Thank you for joining us.